Being a neurologist, I know the value of the speech and audiology and its evaluation in diagnosis and management of the patients. Many of the faculty members train our students in turn for our DM neurology, and we always collaborate with the Department of Speech Pathology and Audiology for the diagnosis as well as for the research. One of the classic example is about primary auditory neuropathy, which is known as PAN. So it is a mutual collaborative work not only in service but also in the training and the research.
And I feel the areas which are absolutely necessary to work, which need a teamwork between an ENT specialist and audiologist speech therapist, is cochlear implant program, voice disorders, and swallowing disorders.
We used to give them a feedback, but the interaction was not so much. Over the last 3 years or so, ever since we've acquired our digital fluoroscopy, we've been interacting with them on a day-to-day basis. Whenever there's a patient who comes with a swallowing disorder, we take their help in performing the swallow study, and whatever maneuvers are required, they help us in demonstrating those maneuvers to the patients. So it's been a good association over the last 3 years, ever since we've started doing the VFSS.
There is a great scope for us to strengthen the interdisciplinary research in the area of cancer rehabilitations and diabetics mellitus. In cancer rehabilitations, especially the patients with head and neck cancer, after chemoradiotherapy or surgical interventions, there is a great challenge as well as scope for the Department of Physiotherapy and Speech and Hearing to rehabilitate them in terms of the functional recovery and speech recovery.
I find there is a commonality in both the departments. Me as an occupational therapist, I'm involved in mobility devices, and whereas professionals in the field of speech and hearing, they are involved in speech related or hearing related assistive technology.
Speech, particularly the swallowing problems. I have more and more patients, particularly are being referred from the neurological services of our institute, and particularly those who have had a cerebrovascular accident, and these patients may be having swallowing disorders, particularly associated with other neurological deficits, and we are in the process of acquiring more and more better softwares for swallowing disorders, so that we can do effective counseling and therapy and diagnosis and all these for swallowing disorders. So this is one area where I think our department intends to do more work in this field.
One area which I would like to highlight is the necessity for building up our own standards. All of us know that we still follow either the ANSI or IEC or ISO standards, which have been developed for an altogether different types of population, different clientele and different environment. The ANSI standard was developed in the year 1969, which was way back, and still we are following that standard. So now our profession in India is completing 50 years and starting the 51st year. It's the right time for us to concentrate on developing our own standards, both for maximum permissible noise levels for an audiometric test room, our own standards for hearing screening, our own standards for diagnostic audiometry, and all diagnosis for which we depend on the standards from either ANSI or IEC or ISO. That's one area which we should focus on.
When it comes to literacy and language, where language, because my core area is learning disability, so that language part of it is something which has to be tapped more, which is there, and literacy with a little bit more of cognitive activities involved in the entire thing. So
And the second untapped area is about the speaker recognition system has shown a considerable progress in the last decade. Performance levels of these systems do not yet seem to warrant large-scale introduction in any other than relative low-risk applications. So more and more involvement of speech language professionals are required in solving the challenges in the field of speaker recognition. Conditions typically of the forensic context, such as differences in recording equipment and transmission channels, the presence of background noise, and of variation due to differences in the communicative context, continue to pose a major challenge. So we expect that the speech and acoustic analysis techniques has to be applied more and more in forensic context solutions in future, and will contribute thereby to the solution of social issues over a wide range and for a safer and more secure life with the involvement of speech and hearing professionals. Thank you.
The field of speech pathology and audiology is an interdisciplinary area. This has led us to be in an enviable position of conducting multidisciplinary research. To conduct such research, our students, researchers, should get their knowledge from various disciplines. The research studies in our country has gone from research confined to the speech pathologist and audiologist room to the involvement with other disciplines. For example, our students of speech and hearing has been given the training to use the MRI software to look at the volume of the corpus callosum or the dimensions of the corpus callosum in relation to the results on dichotic digit test.
We have come to the level of doing online testing. We have come to the level of in therapy, doing tele-speech therapy. And at Ishacon Institute here, we are having a project which is in collaboration with Tata Consultancy Services, where we are trying to do asynchronous therapy. That is, a therapist will be at a village or a semi-urban setup, and he will be doing therapy or the articulation drills through the mobile phone. And if he has a problem, he will give the message onto a server. And on the other side, there will be the therapist with the web console who will check what problems the patient is having at her end, and at her time she will respond. So we are coming to asynchronous therapy, where the client and the therapist do not have to be face to face, and they need not be like in telespeech therapy in front of anything. So we have reached that spot. This appears to be one of the newest things, and this is more of engineers and speech therapists coming together to do something different. The other thing that we needed to do is build bridges between institutes and private practitioners. We need to build bridges between the seniors and juniors. We need to build better bridges between the institutes and the profession and the industry. With this, we could have, if we have the collaboration with industry, we can do a lot to improve the barrier-free environment in different aspects for different disorders. We could have better AAC devices, and industry could really help us include a lot of these apps that we are having. How we could utilize it for our profession. So it is the need of the hour for close collaboration for our profession with the industry.
I feel that there is a lot of lacuna in research in the adolescent language aspect, that's especially from the 10-year above and probably 18 years to 19-year group, wherein a lot of there is a very less research and publications of the disorder specific aspects, and I feel that has to be instigated from all institutes. And I feel that this particular research in this particular aspect can be exhibited in running a lot of surveys, a lot of programs, school-based school screening camps, and it should come out in a form of some sort of publication, be it a journal or chapters in books.
When we talk about funding agencies, there are national level as well as international levels. In terms of national levels, we have Department of Science and Technology, Indian Council of Medical Research, then we have the UGC funding, and then we also have fundings from CSR as well as ICR, as well as certain institutions like All India Institute of Speech and Hearing have funds, internal funds, what they call as ICE Research Fund. Similarly, AYJNHS Institute also have funds for their research grants. In international levels, we have funds from Welcome DPT as well as Obama under Obama Singh Fellowship, under Obama Singh Fellow, under the collaboration of Obama Singh. There are a lot of fundings which talks about research at translational level as well as pure research, which we also need to look from, and we can look for the funding from these agencies.
The funding avenues for research, I would say there are many funding avenues: ICMR, CSIR, DBT, TST. There is Chutani Trust. Various scholarships are available like Mahindra's scholarship, Lady Tata, Ramakrishnan Mission. These are some of the scholarships which are available and could be used for funding avenues.
To speak about the research and research milestones in India in the field of speech and hearing, we'll have to go back to the early 1960s when actually the field sprouted in the country. Since then, along with the clinical practices, they carried out the research activities also, and even they conducted workshops and seminars to give a scientific background on the clinical practices what they did. As per my knowledge, the first national workshop in the field was carried out at Vellore in the year 1966. So things have changed, but still there are few of the pitfalls that slow down the pace of research in the country. To mention few, one is the lack of awareness among the young professionals about the various research methodologies, lack of confidence in them, and then various unethical ways of collecting data, the plagiarism, and even the lack of funding being an important one. Then even the lack of access to good journals and target population also is a problem for young researchers. But I think by the timely intervention by the association and by the senior professionals in the field and by pioneer institutes, a good number of such problems can be solved.
The major milestone has been the development and standardization of various speech audiometric test materials in all major Indian languages. Another has been the development and the adaptation of language tests like LPT, the Western Aphasia Battery, the MTDDA in Indian languages. The prevalence of hearing loss has been studied in various states of India, and recently the effect of mobile phones on hearing has also been studied, which is one of the latest milestones in the field of speech and hearing. We need to conduct multidisciplinary and multi-institutional studies, need to conduct field studies, community-oriented studies to optimize the research, and studies on clinical population is one of the other areas which needs to be taken care of.
What I feel is that it's better to incorporate the eminent personalities not only from our field, from allied professionals also.
What I feel, considering this being the golden jubilee year of the profession in the department, the research is still in its infancy. Research is happening in pockets in our country. However, the way it should happen, I feel, it is not taken up because it is only in the educational institutions that the research happens as a part of dissertations.
The main thing I would wish for is that the young, well-trained budding professionals in our profession should stay in this country and practice here rather than leave it. This again, in order to realize this, we need to address major issues of employment, recruitment for our professionals. There is nothing like how it is done in an engineering profession. We do not have a system which helps our young budding professionals to find employment.
Teaching deserves a lot more attention from the teachers as well as from outsiders, so that we are not only working towards our own self-fulfillment of goals, career goals, but we are making many new professionals who will be spreading the profession far and wide ready. Another thing is to prevent brain drain by providing more exciting opportunities at our own place. As of today, at least what we see is that nearly 50 to 60% of our brain is going abroad, and we need to provide more opportunities for academic, clinic and research here so as to prevent this. To develop absolute professional attitude amongst our own members so that we will get the due respect in the medical fraternity which we deserve.
My vision for my profession is that we increase our numbers and our services are available in all parts of the country. Secondly, the quality of our training should be something that we are proud of, and we are able to attract the best brains to our profession. And finally, that Isha grows on the lines of Asha and becomes the public voice for our profession.
I see the field to be recognized as a separate, independent field, as a specialty where we are not known as therapists or rehabilitationists, but as clinicians, teachers, researchers, and we should be considered at par with other clinical specialties in terms of position, salary, perks and other responsibilities. And I would seek to have a separate speech and hearing council so that our interests are taken care of. And we would like the Isha to be a strong body, similar on lines with that of American Speech and Hearing Association.
I think we would want to see growth and expansion of our field in terms of scope of practice and service delivery. So we should be there in every hospital, every mainstream school, every school, and we should be there as independent professionals who are needed, and we should be present for providing services. And it would be great to see our professional body, our organization develop into an independent regulatory body that will help towards creating higher standards for education, higher trans standards for clinical service delivery, and just I think improve the quality of our work.
We can also extend our hands to the community by collaborating with grassroots level workers as well as NGOs, so that we can reach services and bridge the gap that we often talk about. It's not that it's not happening now. There are lots of people who are engaged in such roles, but having a more sustained effort and a consistent effort towards this direction may be helpful.
Well, my biggest vision is that as a professional, we need to contribute significantly in the lives of persons with communication disorders in such a way that their overall quality of life is improved, and which can be improved only if we develop better strategies, better tools in such a way that our assessment, management and research is of such quality that it improves the overall quality of life of persons with communication disorders, which in turn should influence our policy maker so that the professionals as well as the professions are known across the globe as well as in India. This is what I visualize.
The first ever training program in speech and hearing was a 2 years, 4 months long diploma program which came into existence at the B.Y.L. Nair Hospital and TN Medical College, Mumbai. The course was started in June 1966 thanks to the efforts of Dr. Hiranandani and Mr. Oza. The course was subsequently stopped in the year 1967 and a regular 3-year BSc program was started at that hospital. By now, the All India Institute of Speech and Hearing had come into existence at Mysore, and it started with a 3-year master's program in speech and hearing. This course was open to graduates in linguistics, psychology, physics, maths, etc. the Aish continued to experiment with master's program. First, it was a 3-year master's program, then 1 year pre-MSc plus 2 years regular MSc program, and subsequently in 1970, a 2-year regular master's program was started at the institute. In between, in 1967, Aish started a regular 3-year BSc program in speech and hearing, which continues till today. In the year 2002, the Rehabilitation Council of India added 1 internship year to the 3-year BSc program and made it into a 4-year BSc program. There has been a change in the nomenclature of the bachelor's program. First, it was BSc in speech and hearing. Subsequently, it was bachelor's in audiology and speech therapy, and then bachelor in speech rehabilitation, and the latest bachelor of audiology and speech language pathology. The next level of development was in the year 2002, when bifurcated master's program leading to masters in speech language pathology or masters in audiology was started at the All India Institute of Speech and Hearing. Presently, there are 2 institutes which offer these bifurcated or specialized programs. In the year 1988, NIHH Mumbai started a 1-year diploma program called Diploma in Communication Disorders. This diploma course is now known as Diploma in Speech, Language and Hearing.